So I'd like to introduce Mansour from Bradford now.
Yeah, thank you very much. Thanks, Rosie, and thanks, Ranjit. This is going to be actually do a presentation myself and my colleague Jody, who's been co-leading on this project. So thank you very much for the opportunity. Next slide, please. So our project aim was actually to patient education to help patients living with kidney disease in Bradford Advanced Kidney Care Clinics to make informed treatment choices. Just going to actually give you a bit of a background of how do we deliver patient education sessions. As a face-to-face education sessions, we're supported by literature. We do actually have we had our own literature to start with, kind of develop and produce in-house. But we'll talk about actually the literature that we have developed as part of the Transform AKC project. And we are going to be actually starting to obtain feedback on the education sessions that we have been delivering. Where do we deliver the education sessions? We deliver it on the renal ambulatory care unit, which is actually different from our main renal unit, which is at Bradford Royal Infirmary. So the renal advanced kidney care team is actually based on the non-acute side where the dialysis unit is, and we actually have patients and outpatient clinics are served there. We do actually do some home visits as well for patients who prefer to have the education sessions delivered at home. Who delivers education? That's really important, the right person delivering it. So we do have the advanced care staff, which includes the nursing staff, but Bradford is unique actually in the sense that we have a cultural health improvement officer, Daira Mir, who speaks Punjabi and Urdu and actually helps with the delivering the education to the patients in their own languages. Obviously, we have interpreting services for patients who do not speak English or Urdu or Punjabi. And obviously, the education sessions do not stop here. We do have continual reinforcement of the education and advanced kidney care clinic, and obviously in the general 40 clinics, patients are still based before referred to the AKC clinics. Obviously, we've actually looked into the prioritisation of the referrals, and we've got some data to support that, and incorporation of KFRE as actually it has been used more widely in our general nephrology. There's also primary care, second care. Our main aim actually, as part of the patient education, was to deliver a seminar event for patients by the patients, and Bradford actually takes pride in delivering those sessions in the past, but unfortunately since COVID, we did not have any educational event, and this was actually a very first event that was held on 7th of October last week. And thank you, Dr. Dunbar. Yes, and that event, and we've got some data how the event went and their questionnaire and the survey from that event. Obviously, shared decision making is actually really important as part of our advanced care education sessions and the treatment that we deliver to our patients. Prem questionnaire from Bradford actually locally did show that we were not so good in showing that we did that so well. So we actually looked into shared decision making, and we've got some questionnaire and data to support that moving forward. Using resources and educational tools, and that was one of the very first steps that we did actually as part of a Transform AKC project, was to kind of actually really look into our resources and tools. We did attend an event in Birmingham last year. We found actually there were lots of wealth of kind of actually information resources by Kidney Care UK, and I think was kind of resource and tools. I'm going to be talking about that in the next few slides. And obviously, actually, the questionnaire to evaluate the effectiveness of our educational pathway. It was written and peer reviewed, and we are going to be using our sheet paper. We haven't got the equipment, the iPads in our clinics, but hopefully we'll be able to fund that, and we'll be getting actually some evaluation of the education sessions that we deliver. Next slide, please. Obviously, actually, my colleague before me talked about the driver maps and diagrams. Obviously, we had an idea. We looked into kind of actually what the problem is, and we identified quite a lot of actually issues in the way we delivered our education. So we had an aim. We need to kind of actually look into the processes, and then we had involvement from the staff, the wider MDT, and obviously Bradford actually also has got the highest patient representation in this project as well. So we've got patients who were sat on these meetings. So thank you to Ranjit, Claire, and Leanne and Dr. Dunn for kind of actually attending and visiting us in Bradford, and we went through kind of actually the process mapping and producers diagram will have to be changed quite a few times. I just want to kind of actually let you know that the green indicates that we have achieved that in our first year. So hats off to my colleague Gareth and Jody, who sat here with me in the room, and also kind of actually the orange ones we're working on, and the ones in pink, we are not far from actually achieving them. And our main aim actually for this year was to deliver an educational event, and we've successfully done that, and we've got actually aims to kind of deliver more of those events, and this was the very first of many. Next slide, please. Thank you. Jody?
Yeah. So are we providing education in a timely manner? So I need to thank Hayley for putting all these slides together. So as part of looking at prioritising the referrals that we received in the team, we were patients timely. So we took a more focused look at 2024 data and part of the 2025 data. So as a team, we agreed that seeing patients with a kidney function or a GFR of less than 15 within 1 month of referral seemed reasonable. So the data in 2024 shows that we saw patients on average in 29.5 days from referral to actually receiving education regarding treatment choices. We had quite a big spike in March or April, and that was a patient that was referred to us back in 2022 with a GFR of 18, who we saw in 2024 with a GFR of 15. So next slide, please. So what we looked at was we wanted to try and understand the reasons why we didn't see patients. So the main reason why we didn't see patients was that they were referred when the GFR was too high. So what we do with patients like that is we triage the referrals. We're now looking at the KFRE as well as the EGFR. And if they don't need seeing by us at that time point, we will then just add them to our caseload and monitor. If the GFR rises to above 20, we will then discharge from the caseload and we'll need a re-referral back into the service. So any patient who's on the AKCC caseload, whether they've received education or not, we will make sure that they've had a blood test done every 3 months. And that's really just so that we can make sure there's no surprises and that we're monitoring things. Next slide, please. So the 2025 data, so the median time between referral and education was 26.75 days. And we stopped collecting data in April because we felt that we weren't actually going to make any improvement on that time frame we were seeing patients. Next slide, please. So again, on this slide, we can see that the majority of patients, the reason for them not being seen by us within the month period was that, again, they were referred too soon. So Dr. Ali took this back to the consultants meeting, and it would be interesting actually to look at the data again for maybe the rest of this year to see whether this number is going down and that we are getting more appropriate referrals in. Next slide, please. So as a team, we sat down and discussed the data that we'd obtained. And the baseline days between referral and first education was around 29 days, which was sort of within the month that we did agree. Following team discussion, we felt that because of annual leave, etc., we probably couldn't reduce this any further, so we were happy with that. So we looked at whether we needed to move the focus to retaining the baseline number of days rather than reducing further. And the data showed that we were pretty consistent, so we decided that we were actually going to continue as we are for now. We decided, should we further focus on staff education to address early referrals? And again, Dr. Ali took that back to the consultants meeting, and we decided that that could be done within the team to look at a more local quality improvement focus. And should the team be seeing patients with even higher GFR readings, and was it actually viable for us to see patients with GFRs greater than 16? And we decided as a team that not with the current staffing level we would be able to do that. Next slide, please. These are some photos from Dr. Ali. So Dr. Ali is always good for a good photo. So these are just a few from our patient information event that we held last week. So it was the first information event that we'd held in 9 years. We had 39 carers, patients and family members attend, and we'd got really good support from the Renal MDT, but also from Kidney Care UK, the Kidney Information Network and the Kidney Patient Association, and we were really grateful for everyone attending that those days. Next slide, please. So as the event was only last week, you can probably appreciate we needed to pull the information together quite quickly from the questionnaires. So we only looked at a snapshot of questionnaires that were received back on the day of the event. Some people took questionnaires home, other people just took a photo of the QR code and said that they'd fill it in a later date. But we've had to just look at those that were received on the 7th of October. So the feedback that we received overall was positive, and we asked about the quality of information, the relevance of the day to patient need, the clarity of the speakers, the opportunity to ask questions, the venue, and the overall event organisation, and the feedback on the whole was very good. We do plan to sit down as a team to review the whole feedback and actually look at the common themes and just see where we can make improvements going forwards. Next slide, please. So we were really pleased to see that the majority of people who attended would consider attending another event in the future, or would recommend an event to the families and carers. And we also felt quite very happy that most people felt more informed about managing their condition after attendance at the event. So these are things that we hopefully will continue to address in future sessions. The free text on the comments identified that patients were very, very grateful for the external support, and that they found out where they could gather more information, particularly for carers. And one of the major irks of people was parking, but I think we might get that at any venue that we go to. Next slide, please. So Mansour mentioned earlier about shared decision making and how Bradford, in the 2024 PREM data, along with other sites, it looked at shared decision making as one of the lowest scoring themes. So we decided to have a little look at one of the AKC clinics. So this is a snapshot of just 10 patients. So we looked at asking identical questions from the PREM questionnaire. And we just basically asked these questions to patients in clinic. So 100% of patients said that they'd received a lot of information about kidney disease. And then using the scale of 7 being always and 1 being never, 70% of patients said that we always spoke to them about their treatment choices and life goals, and 30% of patients scored us with a 6. Next slide, please. In involving patients to participate in decisions about kidney care, 60% of patients scored us a 7 and said that they felt that we did, and 40% scored us a 6. And in looking about talking about having a more active role in your managing your kidney condition, 70% of patients said that we did very regularly, and 30% of patients scored us at a 6. So the most common feedback that we got from asking patients these questions is that they didn't really understand what the questions meant. So we felt that it's quite tricky, and we wanted now to move this forward by asking these questions in other advanced kidney care clinics. Next slide, please.
So what we've actually learned, thank you, Jodie, and what we could have actually achieved in the last 12 months or so. So we could have actually know that we're providing education to our patients in a timely manner, and that we've got the data to support that. We've actually updated our key educational resources for patients and received really some positive feedback from the wider MDT. And we've used a Bradford site-specific Kidney Care UK leaflet, and thank you to Kidney Care UK for sending us loads of information resources. And we've actually updated that by going through our communication for patient advisory group as well. And they're really happy to come actually receive those information. We've also ensured that we've actually had some colleagues come and sit with us in those education sessions, and they have so we had peer review of education delivered by different members of the AKC team, and we've actually been told or informed that we had a consistent approach in delivering those education sessions. We've actually engaged and involved patient representation. We've got a Bradford Kidney Patient Association and Kin working really kind of actually closely with us on this and a few other projects as well. We have got a patient who is working on the AKC welcome document, and that is actually in progress at the moment. We plan and prepared for a patient education event on 7th of October. And we've actually got questionnaire and feedback on other areas of importance, such as shared decision making, post-education event, and on the education sessions that we deliver in our advanced kidney care setup. Next slide, please. So what's next for us? Actually, we're aiming for 2 more patient information events across the valley. So we do cover Skipton, Airedale Valley, and other eastern areas, eastern borders of Lancashire. So we've got actually an event sort of lined up for next year, and obviously one in Bradford as well. We're looking at the right person to bring the education, so we are quite unique in actually having Tahir Amir, a cultural improvement officer, in this role, and to see the difference between Tahir's involvement in patient education versus the interpreting services actually involvement there. We're going to incorporate the SILS questionnaire into the nursing assessment when we deliver the education session, and thanks to the work that was done actually by all 3, so we're going to be copying some of that work in and incorporate that into our educational sessions. We've got the AKC welcome pack, which is being delivered at the moment, which is being prepared at the moment. Obviously, we'll continue to update our educational resources. Next slide, please. And obviously benefits in taking part. Not only can we work together as a team, we got to know our team, we got to know the strengths of the team. We've actually reviewed the systems and pathways. We gained patient representation and involvement. We've actually reviewed educational resources. We planned an educational event with the involvement of the wider MDT. We have actually got Hayley Crossley, our data officer. Amazing work done by Hayley to come actually look into our data. Sorry, there's a lot of echo there. I'm not sure if someone's not on mute. And obviously a collaborative approach under the Transform AKC. Transform AKC to make it better. So this is actually, I thought actually really important to put some pictures and to actually review the journey that we started together under sort of Transform AKC. And huge, massive thanks to Dr. Dunn and to Ranjit and Leanne for making this a successful first year. And we've got another 2 years to work with you all. So bear with us. Thank you.